Imagine struggling to draw a full breath, like your chest is filling up with water instead of air. Every year, millions of people face this frightening reality when excess fluid invades their lungs or the space around them. But where does this fluid actually come from, and what do medical teams do to reverse the crisis? The lungs are designed to keep a precise balance, dry enough to swap oxygen and carbon dioxide, yet moist enough to function smoothly. When that balance breaks, two main problems can arise. Pulmonary edema happens when fluid leaks directly into the tiny air sacs called alveoli. These delicate sacs normally let oxygen pass into your blood while pulling carbon dioxide out. Once they flood, oxygen transport stalls and breathlessness follows fast. The second scenario is pleural effusion. Here, fluid collects in the narrow space between your lungs and your rib cage, the pleural space. Even though the fluid stays outside the lung tissue, it presses against the lungs like a heavy hand, stopping them from expanding fully. Have you ever tried inhaling while wearing a too tight vest? That crushing sensation is exactly what pleural effusion feels like. What triggers these buildups? Heart failure tops the list. When the heart's pumping power weakens, pressure rises inside the lungs' blood vessels. That extra force shoves fluid right out of the vessels and into the alveoli. Pneumonia is another major culprit. Infection sparks inflammation, which makes lung tissues pour out extra fluid. Kidney disease can also overload the body with fluid because damaged kidneys can't filter out the excess. Severe injuries, inhaling toxic smoke, or conditions like ARDS, acute respiratory distress syndrome, push fluid into the lungs too. So how do doctors actually get that fluid out? The answer depends on where the fluid sits and what caused it. One of the first weapons they reach for is a class of drugs called diuretics. Diuretics order your kidneys to produce more urine, flushing out extra water from your entire system. For heart failure patients, reducing total fluid volume lowers the pressure inside lung vessels, giving the alveoli a chance to dry out gradually. Oxygen therapy is another frontline tool. When fluid clogs the gas exchange zones, blood oxygen can plummet dangerously. Supplemental oxygen, delivered through soft nasal prongs, a face mask, or even high-flow devices, buys precious time for the heart and brain. Would you believe that simply adding oxygen can reduce the workload on a struggling heart by nearly 20%? In moderate to severe cases, doctors turn to non-invasive ventilation like CPAP or BiPAP. These machines blow slightly pressurized air into the airways, acting like an internal splint. The gentle pressure helps push stray fluid out of the alveoli and keeps collapsed air sacs open. For many patients, this alone can avoid the need for a breathing tube. But what if the fluid surrounds the lungs instead of filling them from inside? That's when a procedure called thoracentesis becomes the star. A physician numbs a spot on your back or side, then guides a thin needle through the chest wall into the pleural space. Draining the fluid often brings immediate relief. Imagine finally releasing a pressure valve you didn't know was stuck. The removed fluid also goes to a lab, where tests reveal if infection, cancer, or inflammation is the hidden driver. For larger or rapidly returning effusions, a chest tube may be placed. This soft, flexible tube connects to a sealed drainage system that continuously pulls fluid out, sometimes for days. And for people who keep refilling that space, specialists may perform pleurodesis, a technique where they inject a mild irritant into the pleural cavity. The irritation makes the lung stick to the chest wall, eliminating the space where fluid used to collect. Of course, removing the fluid is only half the battle. The root cause must be treated too. Heart failure gets managed with drugs that strengthen pumping and lower blood pressure. Pneumonia demands antibiotics or antivirals. If kidneys are the weak link, improving their function or using dialysis to pull off excess fluid becomes essential. Draining the chest buys time. Healing the cause buys a future. Sometimes, the situation escalates to full respiratory failure. Then mechanical ventilation takes over. A breathing tube is inserted, and a ventilator machine does the work of moving air in and out. This rest gives the lungs a chance to heal, often over several days, while oxygen levels stay safe and carbon dioxide gets cleared. Prevention and long-term management matter just as much as emergency care. For heart-related fluid buildup, cutting back on salt is a game changer. Less sodium means less water retention. Sticking to prescribed medications, keeping a healthy weight, and staying active, within medical limits, can dramatically lower the risk of a repeat crisis. Have you ever thought about how many hospital readmissions could be prevented simply by monitoring daily weight? A sudden gain of 2 to 3 pounds in 24 hours can be an early red flag for fluid overload. Learning to recognize symptoms saves lives. Watch for shortness of breath that worsens when lying down, a cough that brings up frothy or pink-tinged phlegm, chest tightness, wheezing, and unusual fatigue. Swollen ankles or legs often accompany heart failure, giving you another clue. Your body whispers warnings long before it shouts. Learn to listen. Respiratory therapists and critical care nurses play a huge role in this process. They track oxygen levels, adjust breathing machines, teach patients home monitoring tricks, and coach families on when to rush to the ER. Their expertise often makes the difference between a quick recovery and a downhill slide. Recovery time varies. A young person with pneumonia-related fluid might bounce back in a week. Someone with chronic heart failure may need lifelong management. The good news: early diagnosis and prompt treatment dramatically improve outcomes. Fluid in the lungs sounds terrifying, but modern medicine has an impressive toolkit: diuretics, oxygen, chest drains, ventilators, and targeted drugs for whatever started the problem. If this information helped you understand a scary condition a little better, hit that like button for the channel Winds of Thought. We turn complex medical mysteries into clear, actionable knowledge. Stick around for more videos that explain what your body is trying to tell you.